I just want to talk about the art of listening. Now, the art of listening, if you want to work in the field of therapy, is probably the most important skill to develop. It is absolutely essential. But firstly, to understand why, look, for a patient, there's a simple truth. For a patient, being heard is probably more important and more healing than any advice a therapist can actually give. That is a simple truth about therapy. Once you get that into your head, you learn why listening is so important. But basically nobody is born a great listener. Everybody needs to work on themselves and develop this skill. And there's a few tips. Firstly, you basically have to have a natural curiosity about the other person. Always, always be curious about the person. Basically, learn to profile them. Find out as much information about them as possible. Their background, their childhood, what shaped them, their friends, relationships, their school experiences, their family background. You basically build up a picture, a profile of the person. Secondly, I just got to say, when you're in therapy, as regards listening, you have to basically allow for silences. You can't keep just being constantly pop a question all the time out of a sense of awkwardness, feeling you have to fill the silences. You have to allow for silences, allow the patient open up and basically reveal unconscious desires, feelings, and thoughts. Allow those thoughts come to mind. You need silences to allow that rapport to develop, to build up a relationship with the patient. You have to remember, if you keep popping a question all the time, it's not going to feel natural. It's not going to feel normal for the patient, and it's going to pressure them too much. Don't think silences are awkward. They're actually a time when you will learn a lot about the patient. Revealing body language, unconscious communication. You will pick up on a lot of stuff from the patient. Their innermost desires and how they interact. But look, basically, with being in therapy, being a patient myself, you got to remember that being in therapy is a bit like peeling back an onion. It takes a lot of time to get the patient to open up and reveal their innermost self. It's not something you do overnight. As I said, society is pretty cynical. Patients need time to open up. The best way, it's not just the art of listening. You have to learn to develop a rapport with the patient. You have to learn to basically be a friend, to listen, to care, to understand, and to gain their trust. And then you'll have a brilliant relationship with your patient and you'll help them so much.